After 24 to 48 hours, it will be time to remove your dressing and replace it with a fresh one. If you're on blood thinners, then you may need to wait longer, so be sure to follow the advice of your physician. Before you begin, you'll need to set up the following supplies: clean water in a clean container, soap, cotton tip applicators, ointment as recommended by your surgeon, petroleum jelly is the most common, non-stick Telfa dressings, gauze, adhesive tape, scissors, and a plastic bag and a trash receptacle to receive the old dressing. Please note that if you've had a skin graft or a staged repair, you will need to follow your physician's instructions. Next, you'll need to remove and properly dispose of your dressing. Before you begin, thoroughly wash your hands with soap and water. Then gently remove the dressing. You can do this by moistening one corner, then holding the surrounding skin with your non-dominant hand, and then lifting and peeling it back towards the wound with your dominant hand. If it's difficult to remove, moisten it with additional water. Or, at this point, you may find it easier to go into the shower and let the running water loosen the dressing for you. Your soiled dressing is contaminated biowaste, a hazardous pollutant. If not properly disposed of, biowaste can contaminate our water sources, the soil, and cause serious sickness in both animals and people. To help keep our environment healthy, it's very important that you take the proper steps to dispose of your soiled dressing. First, place your soiled dressing in a plastic bag and seal it securely, either with a Ziploc, twist tie, or a square knot. Then place it in the trash receptacle. Do not place it in the recycling or the compost bins. Then, wash your hands again. Next, you'll need to clean and evaluate your wound. Saturate a piece of gauze with water and hold it against the wound to soften it. Then wet a cotton tip applicator with water and gently roll it up and down the incision until it's clean. Once you have cleaned the incision, your next step is to inspect it. Once you remove the dressing, you may find that your wound has been closed with staples, glue, skin closure strips, or held together with stitches. Regardless of the type of wound closure used, a normal wound can look slightly pink and perhaps a tad swollen. If on inspection you observe separation of your stitches, active bleeding, puffiness, expanding redness, extreme tenderness, worsening pain, warmness to touch, or if it smells malodorous, you see pus, or if you are experiencing a fever above 101 degrees, chills, nausea, or vomiting, you should call your physician right away. To put on a fresh dressing, first apply the ointment evenly along the incision. Cover the wound with a nonstick pad, and then cover the entire dressing with adhesive tape. In some cases, you may find it's easier to cover the wound with a simple bandage. When you are done, wash your hands again. You'll need to change your dressing once a day until you have your sutures removed or you are directed by your physician. If you received dissolvable sutures, your physician will not need to remove them. They will usually dissolve in 10 days to 2 weeks. However, do not be concerned if they dissolve earlier or later than expected. You may also see some extra redness on or around the wound as it heals. You'll need to change your dressing once a day for approximately 10 days. If the wound has been covered with skin closure strips, remove the pressure dressing after 24 hours and then follow the advice of your physician.